So, good afternoon, friends. And today we are going to talk about checklist, rating scales, rubrics, and global ratings. They can be used for a variety of purposes, from simple feedback to assessment to provide feedback. Getting feedback, assessing, and providing feedback. In fact, once we went out for a famous dinner, and at the end of the dinner, that hotel fellow brought a piece of paper on which there were only three things written. Wow, so so, oh no. But it conveyed the meaning. It also tells you that you don't necessarily have to really make very complicated checklists and rating scales. Again, it all depends on your purpose. Why are you making it? And your purpose decides how elaborate, how complicated, how big, how simple should be your rating scales. Just for sake of knowing where we stand, can you tell me the difference between rating scale and checklist?
So we rate
Try doing it. Huh.
certain assessment on a scale of 1 to 5, say, according to certain measures which they are going to follow. In checklist, we basically see what are the criteria being followed or not, all the criteria. But in rating scale, we just rate them according to some.
And what is global rating? Lovely.
So global rating scales, another parameter to check. It is a type of rating scale only, and it is.
But what is the difference between a rating scale and a global rating scale?
Rating scale में वो rating कोई भी हो सकती है. Global rating में good, very good ऐसे करके they are more defined, standardized. Global rating scale is more standardized, and rating scales could be made by you, me.
Would you like to add something? Global rating. Any difference between rating scale and global rating? Okay, so we'll discuss some of these issues today. And rather than going theoretically on designing various rating scales also, we would actually try to focus on their utility in medical education as to how exactly you can use, and especially for student assessment, because that is one area where it can help us a lot. So all the three, you must have realized, relate to assessment of performance. You don't use them for assessing knowledge. Rather, you use them for rating performance and affective domain. Most of the points in affective domain, for example, ethics, professionalism, you can't see just like this. So you have to make an inference from the behavior. So how did the student interact with the patient? That is the behavior. And from there you interpret as to how good or how bad is the communication. So when I say performance, I am talking of psychomotor skills, and I'm talking of affective skills. And one important thing actually, which also is very helpful and which adds to the value of both rating scales and checklist, is rubric. We don't use it too frequently. In fact, we don't even design them very often for our work. But especially for practical skills, rubrics can add a lot. And when I say practical, for psychomotor, for communication, for example, for ethics, professionalism, their rubrics can play a lot of role in making your performance assessment more standardized. Now, let's come to checklist. The basically purpose of checklist is to see if a set of actions has been performed correctly. So suppose, for example, you want to have a standard protocol for somebody to come and open this room in the morning. So you'll have a standard protocol. He comes at 9, he opens the lock, he puts the AC on, he puts the fans on, he cleans the floor, sets the laptop, and so on. So there's a standardized protocol. And you want to see if all the actions have been correctly done. But please remember, the checklist allow only a binary marking. That means yes or no. So done or not done. And in student assessment, you must be aware that many times simply this binary marking doesn't help. Especially when you are dealing with issues like communication or when you are dealing with professionalism. Yes, no doesn't help you. You want to really quantify how much. And that is one of the lacunae of using checklist because they allow only binary marking. On the positive side, they are more objective than rating scales because they allow only yes, no. It's like MCQ, right or wrong. And so they are more objective. Contrasted to rating scales, which are like essay type questions. So the student has written, he has performed, and then you have to decide, okay, this point goes in favor, this goes against, this was not required, this he missed out. So my overall impression is this. One modification which you can do to the rating scales is actually to provide weight. If I take the same example of opening this room, and if you think starting the AC is the first important thing in the morning so that people don't feel hot when they come in. So you can give it 2 marks. Whereas sweeping the floor can be given only half a mark. So you can provide a weight. Same way in communication, for example. If using a language which is comprehensible to the patient is more important, you can give it more points. If only including the content is important, you can give that as more points. So again, it will depend on the purpose. Why are you making that instrument or that tool? And you can also use it sequentially. For example, the taste of food was very good. Yes, no. If you say yes, please write in 2 lines why you say it was very good. Or if you say no, write in 2 lines why you think it was not. So you can use both open-ended questions followed by closed-ended questions. Now the advantage is that sometimes yes, no don't really give you the true picture. But when you have a reasoning coming into it, then you can actually understand the students' learning in a better way. Here is an example. An example of a checklist for doing urine sugar. Just look at the scale and tell me what attracts your attention.
It is binary.
Okay.
It does not add weightage to any particular step.
Okay. So no weightage has been provided. All the items are given
One or two.
equal weight and
Pass score is 87.3.
that is the point which you should notice. Because many times we tend to apply the same 50% criteria to these kind of things. See, as such, chance of guessing is 50-50. So if you put 50% as pass marks, then you would probably be losing out on a lot of information. Here, if you see, for example, wash hands thoroughly, this is an important point. But if the student doesn't wash hand, you don't do anything. So maybe giving a higher weightage. You decide. I mean, depending on which department, which area, which level of student, which purpose. Basically, these are from nursing. But if you are making it for your medical students, then you can decide. In microbiology, for example, you could give maybe more weight to this. In biochemistry, you could probably give more weight to the interpretation part. And then, 8 drops, which is the crucial step, should possibly get a more weight as compared to uh, treating everything uniformly. Okay, let's look at another example. Again from nursing, antenatal checkup. What actually attracts attention is pass mark. So 50% criteria won't suffice. Are they objective? जोर से बोलो.
They are, but we can give remarks. We can do.
So apparently they appear objective, but if you look at the points, they require to make a subjective interpretation before you objectively mark them.
Explains findings to mother.
Some of the things, for example, wash hands and communicates, this may be okay, but even communicates. You have to make a subjective decision first. Communication was okay. So I'll give yes or one, whatever. Same way, he observes the abdomen. Now, this is a bit of a problem. Suppose he stands like this near the cord. वो ऑब्जर्व तो हो गया, पर आपने ये तो देखा नहीं ना उसने ऑब्जर्व क्या किया. Many years ago, I was invited for a NBE, National Board Practical Examination, and they have an OSCE. It was very funny. Checklist was like there was a neonate, and the points were he is lying prone. Or he uses cotton to assess superficial sensations in a 2-year-old child. अब सारा कुछ पढ़ा होता था, स्टूडेंट आते हैं, वो उठाया तो नंबर मिल गए उसको. उसने क्या किया ये तो उसमें कहीं बिल्ड नहीं. So they give a semblance of objectivity, but in fact, many of them may not be purely objective. They require a subjective decision to make an objective assessment. You remember last time's talk when I used the term objectification. You decide subjectively, measure objectively, which doesn't really give a better information as compared to purely subjective assessment.
Can अगर हम communicate की बजाय ये लिख देते कि communicates what to the mother, then it can be more objective. The objectivity can be increased.
Yes, you can increase it, but वो आएंगे. We'll talk about this point a little later. Yet another about neonatal resuscitation, again from nursing. And if you see, actually the pass marks are almost 9 to 11, 9 out of 11. That means about 80-85%. So all checklists and using blanket 50% pass marks is actually not the right approach to do. So how do you decide what is the pass marks?
Depending upon the weightage of the thing. Checklist.
Okay, there is a process called standard setting. So maybe you just Google it and read about standard setting in performance assessment. So a group of experts, they sit and decide that a person who should just pass, not 60%, 70%, a person whom we say, okay, let him pass. वो इसमें से क्या क्या कर लेगा? And then based on that, you make a mean calculation of all the assessors that at least 8 things out of 11 should be done by this student. So standard setting is a integral part of making checklists and rating scales, because without standard setting, 50% will probably not suffice. Now, if you look at the advantages, they are easy, simple.
Not easy to make.
They are, I would say, they are rather easy.
They make the job easy. Yes, assessment.
No, even making them is easy, because what it simply means is that you write the steps. तो जो आपने पढ़ाया है वही आप steps लिख दो, तो it becomes easy. I mean, should not be very difficult. Only thing you have to be clear is that everybody interprets it the same way. You know, if people have different interpretation of different points, then you can have problems. They are adaptable. You can use it in any critical situation. All that you have to do is to list the activities which the students need to perform. And so the chances of error are less. Like वो फर्स्ट यूरिन एग्जामिनेशन वाला, अगर बाई चांस आप 8 ड्रॉप्स काउंट करना मिस कर गए तो बाकी सारा उसने भले ही बड़ा अच्छा किया, बट देन योर असेसमेंट विल बी रॉन्ग. समटाइम्स वो रिकॉर्ड बीपी इज ए वेरी फेवरेट स्टेशन. पूरी हिंदुस्तान में चले जाओ, वो बीपी वाला जरूर आपको मिलता है. एंड उसमें दिल से ही इन्फ्लेटेड above certain level. अब examiner can't listen to the sound unless you are having a two-way stethoscope. You know, so it's all kind of subjective assessment only, but then that's what it is. And objectivity, I have already said, they appear objective, but not really objective. Many a times you have to make a subjective judgment before you can make a objective decision on whether the student did it or didn't do it. So there are challenges. And one of the major challenges is to define the completeness of the task. Like you said, communication. तो हम ये भी लिखते हैं, ये भी लिख दें, ये भी लिख दें. You know, still you can never be sure कि अब बस हो गया, इसके आगे कुछ नहीं ऐड हो सकता. That is generally not possible. You know, you can always keep on adding things to that. So completeness of the task, and this is particularly true of affective domain. साइकोमोटर में फिर भी आप कह सकते हो कि चलो इतना कर लिया तो ठीक है, बट इफेक्टिव में इट्स बिकम्स ए प्रॉब्लम. कहाँ पे कम्युनिकेशन बोलेंगे कि अब परफेक्ट हो गया, या कहाँ पे बोलेंगे एथिक्स परफेक्ट हो गई, दैट बिकम्स डिफिकल्ट. एंड लेंथ ऑफ द चेकलिस्ट इम्पैक्ट्स क्वालिटी. सो इफ यू मेक इट लॉन्गर, यू नो, थोड़ी देर में एग्जामिनर भी बोर हो जाता है, स्टूडेंट भी बोर हो जाता है. सो यू कांट अफोर्ड टू हैव टू लॉन्ग अ चेकलिस्ट. In fact, I remember when this macro teaching started in basic training courses, and then people would search the net, and a micro teaching checklist would consist of something like 75 to 80 items. It becomes very difficult in a 5-minute session to assess 70, 80 items was practically impossible. So the recommendation is 15 are okay.
Shouldn't it depend on time? If we are assessing the student only for 3 minutes, for 2 minutes, 15 उसके लिए जाना चाहिए.
Time बढ़ा दो. You know, if your task is so small that you can do it only within 2 minutes, then okay, you have lesser numbers.
Giving an IV injection. Giving an IV injection on a minute. We are assessing that. And for 2-3 minutes we have.
नहीं, अब उसमें डिपेंड करता है कि आप खाली लिम मैनिकिन पे करा रहे हो कि उसमें कम्युनिकेशन भी देख रहे हो, कि उसमें प्रोफेशनलिज्म भी देख रहे हो. You know, it all depends. If you're just focusing only on the technical part of it, then maybe okay. And I would refer you to one of our papers, Skill or Competency, which came last month in Indian Pediatrics. You can actually Google it and get skill or competency. What should we be assessing? And that actually discusses these aspects. We keep on assessing skills. We actually don't assess competencies. When you say competency, then it also means a combination of knowledge, attitude, skill, communication, reflection, etc., etc. So it depends. I mean, if you want to assess only बस needle घुसानी है और निकालनी है, then maybe yes, 2 minutes are okay. But if you want to add communication, अब मैं तुमको इंजेक्शन लगाने जा रहा हूँ या अब थोड़ा सा दर्द होगा, फिर उसके बाद ऐसे मोड़ना हाथ, फिर ऐसे रखना, all those things are required. They are also not very effective for providing feedback. क्योंकि आप बाइनरी कर रहे हो, yes or no, उसमें आप उसकी क्वांटिफिकेशन नहीं कर पा रहे हो. So feedback becomes a little difficult. You can say you didn't do this, but maybe he has done it wrongly. So that you may not be able to pick up in a checklist. Now, before I proceed to rating scales, have you read about these types of scales?
Yes.
Yeah? So just a recap. So you have nominal, which are names and gender and rural, urban. यहाँ पे जरा दो तीन क्लासिफिकेशन पॉसिबल होते हैं. सेकंड इज ऑर्डिनल, वेयर यू कैन रैंक ऑर्डर देम. ये वेट हो गया, हाइट हो गई, टेम्परेचर हो गया. थर्ड इज इंटरवल, जहां पे डिफरेंस बिटवीन 5 to 10 degree is same as difference between 10 to 15 degree. ठीक है. So 0 degree centigrade to 10 degree centigrade is a difference of 10 degrees, and same way 50 to 60 degree centigrade is also a 10 degree. And then comes, but यहाँ पे रेशो नहीं लगा सकते. You cannot say कि जो 0 डिग्री है वो 2 डिग्री से दुगना ठंडा है, या 5 डिग्री 10 डिग्री से आधा गर्म है. You cannot do that. So they are not ratios. And last is the ratio scale. A typical example is weight. So आधा किलो 1 किलो से आधा है, और 5 किलो 1 किलो से 5 गुना है. That ratios you can actually adapt in ratio type of scales. जो नॉमिनल स्केल्स होती हैं वो वेरिएबल्स को आप लेबल करने में यूज करते हो कि रूरल अर्बन इतने थे, मेल फीमेल इतने थे, यंग और ओल्ड इतने थे, बट दे डोंट हैव ए क्वांटिटेटिव वैल्यू. Some examples are there, and you use it only where these variables are important. जहां आप देख रहे हो मेल स्टूडेंट वर्सेस फीमेल स्टूडेंट्स, वहां पे ये स्केल आप लगा सकते हो. बट वन वेरी कॉमन मिस्टेक विच वी मेक, कि हम इसको टोटल कर देते हैं. In the next one, I'll give you example, which will sound more practicable. Ordinal scale. Ordinal scales are non-mathematical. You cannot multiply something by something. You cannot say 2 और 4 का एवरेज 3 है, right? But you cannot say कि unsatisfactory और good का एवरेज satisfactory है. And that we often do. जो मेजॉरिटी ऑफ सो कॉल्ड लाइकर्ट स्केल्स लोग इस्तेमाल करते हैं वो ऐसे ही करते हैं. वो वैल्यूज निकाल लेते हैं, फिर उसको जोड़ देते हैं, फिर उसका मीन निकाल लेते हैं, फिर उसको मल्टीप्लाई कर देते हैं, विच इज नॉट द right thing to do. You have to use it as independent measures. So many said satisfactory, so many said unsatisfactory, so many said good. But you cannot take a mean out of it. Make it like this. रेस्टोरेंट में खाना खाने जाते हो तो ये कहते हैं ना, अभी सब्जी बहुत अच्छी थी, रोटी इतनी ठीक नहीं थी, डेजर्ट बहुत अच्छी थी. यू डोंट टेक ए मीन, ऑन एन एवरेज ठीक था, भले ही वो रोटी नहीं खाई गई हो आपसे, बिकॉज बाकी दो चीजें बहुत अच्छी थी. And we don't know what is the distance between variables. तो अनसेटिस्फैक्ट्री और सेटिस्फैक्ट्री में कितना फर्क है हमको नहीं पता. दो डिफरेंट एग्जामिनर, एक सेटिस्फैक्ट्री कह रहा है एक स्टूडेंट को, दूसरे को अनसेटिस्फैक्ट्री कह रहा है, और another examiner doing the same thing. You don't know how much is the difference in performance. Most often what happens is that examiners, they have their own frame of reference. मैं ऐसे करता, और अगर उसने मेरे हिसाब से नहीं किया तो वो अनसेटिस्फैक्ट्री हो गया. अब ये फ्रेम ऑफ रेफरेंस हर एग्जामिनर का फर्क होता है. कई होते हैं चलो कोई नहीं, चलने दो, जाने दो. कई होते हैं कोई नहीं, बच्चा है, सीख जाएगा वैरायटी. कुछ होते हैं अरे ये भी नहीं किया, हाउ कैन ही पास. सो इट ऑल डिपेंड्स ऑन एग्जामिनर्स perceptions of the value. And the point I want to emphasize here is that you cannot do a mathematical function on ordinal scales. Don't try to add, don't try to take a mean, don't try to multiply, don't try to subtract.
Likert scale are a type of ordinal scale. Sir, हम 5 Likert scale को 3 में ले आते हैं ऐड करके, तो that should not be done. In the first time only हम 3 point Likert scale यूज कर लें.
वो इंटरप्रिटेशन फिर फर्क हो जाता है. rather than saying कि 5% ने कहा 1 और 10% ने कहा 2, तो on an average 7.5% हो गया. That is wrong. Okay, what you need to do is make it binary in the sense कि कितनों ने कहा अच्छा है, कितनों ने कहा बुरा है. अब वो डिपेंड करता है कि आपने वो क्यों बनाई थी. अगर आप सिर्फ यही देखना चाहते हो कि कितने अच्छे कितने बुरे, सिर्फ हैव 3 पॉइंट्स. अगर आप ये देखना चाहते हो कि नहीं, अच्छे में ग्रेडिंग ऑफ अच्छा, then have 5 points. In fact, you can go up to 11 points, 13 points. But depending on the maturity of the respondent, try imagining talking to a village lady. उसको आप एक आइसक्रीम खिलाओ और फिर उसको पूछो माता जी कितना सी है, अच्छा सी कि थोड़ा अच्छा सी कि होर ज्यादा अच्छा सी कि होर ज्यादा अच्छा सी. She'll get confused. And even the answers that you would get would not help you in any way. On the other hand, if you had simply asked अच्छी सी कि नहीं सी, probably that will help you better. अगर अच्छी नहीं सी तो क्यों नहीं अच्छी सी, बस that probably helps you better. So
we use these Likert scale for getting feedback. Feedback from the students also, feedback from the faculty also. So taking a feedback of
मेरे को क्या था उसमें,
a 3 point Likert scale for a student would be sufficient, and from the teaching faculty जो involved हुई, उन्होंने we could use a 5 point Likert scale.
वो भी डिपेंड करता है कि आप उसमें से क्या निकालने की कोशिश कर रहे हो. It, as I said, the interval is not same. तो अगर आप कह रहे हो कि देखो 10 स्टूडेंट ने कहा था गुड है और 20 ने कहा था वेरी गुड है, तो इट डजंट मीन कि मतलब वो बहुत अच्छा हो गया. Because the difference between good and very good will be very different for different respondents and teachers and designers. So इसलिए that doesn't really help you. और actually feedback के लिए I won't use Likert scale. Likert scale वहां पे यूज करना चाहिए जहां पे आप चीज को क्वांटिफाई कर सको. मैंने नया मेथड लगाया, ये अच्छा था कि बहुत अच्छा था कि उससे भी अच्छा था कि उससे भी अच्छा था, that doesn't really make a difference. Then coming to interval scales, इंटरवल स्केल्स में क्या होता है कि डिफरेंस बराबर होता है, लाइक बिटवीन 0 and 10 and 10 and 20 द डिफरेंस विल बी द सेम। और यहाँ पे आप स्टैटिस्टिक्स लगा सकते हो। प्लीज रिमेंबर, यहाँ पे एब्सोल्यूट जीरो नहीं होती। जब आप 0 डिग्री टेम्परेचर कहते हो तो इट डजंट मीन एब्सेंस ऑफ टेम्परेचर, वो भी तो टेम्परेचर है। 0 डिग्री इज ऑल्सो टेम्परेचर, so there is no zero in interval scales. On the other hand, in ratio scales, for example, weight or length, they have an absolute zero. When you say weight is zero, that means no weight. But temperature is zero, doesn't mean no temperature. So just keep these points in mind. Now, when do you use rating scales? Actually, they are a variation of MCQ format, where you give a series of statements and then they have to agree or disagree with the statement that you have actually provided. So when you want a closed-ended survey question, you could use scales. Or when you want to associate a qualitative observation, like communicate mother के साथ किया, कितना अच्छा किया, that is where you could use rating scales. But please remember, वो good और very good का difference और poor और very poor का difference is not the same. So you have to be careful in making an interpretation when you are using that. And so they can provide you more information than yes or no. जो checklist थी वो खाली yes no provide कर रही थी। जो rating scales हैं, they are providing you more information compared to simple yes or no. We already discussed this. The distance is not the same. Again, they can be subjective or objective, depending on the purpose, design, and assessor literacy. आप कोई सर्जिकल प्रोसीजर कर रहे हो और उसमें सपोज हाइपोथेटिकली कुछ ऐसा है कि उसने 1 सेंटीमीटर का कट लगाया, 2 सेंटीमीटर का लगाया, 3 सेंटीमीटर का लगाया, तो रेटिंग स्केल आप वहां पे यूज कर सकते हो इजीली। सो विच कुड बी objective. Everybody would market the safety. Take, for example, this scale. Now, this is a problem solving scale, and you put the student's name, and then you decide where you want to put yourself on. But please don't add up all the 5 points. Very commonly, all the publications you see with Likert scale and so on, they'll add up both ways, vertically also, horizontally also. So don't add up either vertically or horizontally. Each one of them has to be separately reported. When we use these scales in educational work, then one of our assumptions is that all the things are equidistant. Although we started with the premise that they are not equidistant, but here we begin with equidistant. So between strongly agree and agree, we think it's the same as between disagree and strongly disagree. So if you have a statement like this, that he demonstrated professionalism appropriate to his level of training, then you could possibly rank him on this scale. There's another type of scale, which is called a behaviorally anchored rating scale. Now, as the name indicates, it's not just good or bad, or satisfactory or unsatisfactory. It is linked to the behavior. I'll give you an example. But it has two issues. One, that it requires a lot of user training to interpret that behavior. And secondly, defining those behaviors might be challenging. What is good communication for me may not be for you. and what is for you may not be for her. So that actually can create an issue. Here you can see a typical example of a behavior anchored rating scale. So what is happening here is that you, in a usual Likert scale, you would have put it like this: poor, fair, good, excellent. In between, you might have said don't know. पर यहाँ पे हर बिहेवियर का एक डिस्क्रिप्शन दिया हुआ है. So, for example, if a student interrupts the patient more than twice or up to 2 times, one time, and doesn't interrupt. So this becomes little more objective and little more valid in the sense that you are actually linking it to the behavior demonstrated by the student. And when you tell somebody or when you report that his communication was good, then the person at the other end understands that when you are saying good, what you mean is that he interrupted the patient not more than once, he rarely used jargon, and he used one open-ended question. But please remember, this has to be based on your training. अब अगर आपने ये ओपन एंडेड क्वेश्चन की इंपॉर्टेंस नहीं सिखाई है तो फिर आप उसको स्केल में नहीं डाल सकते. This is a very common scale used for mini CX. I'm sure most of you have seen that form. And at the back of the form, you have this description of the various competencies that you assess using a mini CX. Now, what you see here is the minimum acceptable required. So, अगर वो 9-point scale है mini CX वाला, तो this would fit at 5. जिसको आप 5 दे रहे हो, he should be performing all these things. यहाँ तक ऑब्जेक्टिव है, पर वो 5 की जगह 4 देना है कि 3 देना है, वो थोड़ा सब्जेक्टिव डिसीजन हो जाता है बेस्ड ऑन योर ओन परसेप्शंस एंड योर ओन एक्सपीरियंस. अब नंबर ऑफ रेटिंग पॉइंट्स we were discussing. So it depends on what you are looking for. And it also depends on the maturity of the respondents and assessor. I gave you that ice cream example. अब वो अगर 11 पॉइंट की स्केल बना दोगे तो कोई कुछ नहीं कर पाएगा उसका. So if you simply want to know कि देखो आज ये नया मेथड मैंने लगाया था, अच्छा था, they have to say yes or no. So 3 points may probably be okay. But if you want a little more, then you could make it 5 points. More than 7 becomes an issue. You know, to distinguish between good, very good, and highly very good, and that will be an issue. So avoid going more than 7. Or generally, most of these scales have one neutral point in between, you know, where you say don't know, can't say, जो भी नाम आपने उसको देना पड़ेगा. Advantages of rating scale: easy. They can test wider range of capabilities. जो चेकलिस्ट है वो सिर्फ वही टास्क चेक कर सकती है. जो रेटिंग स्केल है वो इट कैन गो बियॉन्ड द टास्क. And especially when you are dealing with areas like interest, attitude, professionalism, communication, rating scale is a better option compared to checklist, and they help you in providing feedback to the student. But they can be difficult to construct. और वो डिफिकल्टी ये होती है कि हम उसको अपने हिसाब से बनाते हैं. हम क्या सोच रहे हैं हम वो लिख देते हैं, which may not be same as what you are thinking or what you are thinking. So that has to be balanced. No, I'm not going into too many details of how to make a scale, but there are articles available. You can actually find them out and see how to design a Likert scale. The next comes global rating. Global rating means that without using any of the prompts, you are rating the performance of the student. चेकलिस्ट में आप क्या कर रहे थे? यस नो कर रहे थे. रेटिंग्स में क्या कर रहे थे? आपके पॉइंट आपने लिख रखे थे, उसके बेस पे आप उसको 1 2 3 4 कर रहे थे. ग्लोबल रेटिंग में आप उसको ओवरऑल बताते हो. पेशेंट ने आके स्टूडेंट ने आके पेशेंट का एब्डोमेन पैल्पेट किया. अब चेकलिस्ट में यस नो पे जाओगे, रेटिंग स्केल में गुड वेरी गुड सेटिस्फैक्ट्री पे जाओगे. ग्लोबल रेटिंग में आप ओवरऑल बताओगे कि मेरे हिसाब से स्टूडेंट बहुत अच्छा किया, ये आया, इसने पेशेंट से बात की, उसको कंफर्टेबली लिटाया, और ये वाला पॉइंट इसने ठीक नहीं किया, बट ओवरऑल आई वुड से दैट ही डिजर्व्स टू पास. सो दैट इज एन एग्जांपल ऑफ ग्लोबल रेटिंग. और one of the best ways which I have used and found extremely easy to do is to explain your grades. जैसे अगर आप उसको 5 नंबर दे रहे हो, तो आप 4 लाइनें लिख दो कि आपने 5 नंबर क्यों दिए. सो व्हाट डज दैट? वो उसको भी बता देता है कि अगली बार बेटर करना है तो क्या करना है. और हम जब भी ये फीडबैक वगैरह का सोचते हैं, हम हमेशा वो 4 और 5 सोचते हैं, हम 8 और 9 नहीं सोचते. तो जिसको 8 मिले उसको भी अगर आप बताओ कि तेरे को 8 मैंने क्यों दिए, तो वो वही चीज आगे फिर से यूज कर सकता है. आई हैड दिस एक्सपीरियंस इन माय फाइनल ईयर एमबीबीएस. हमारा मेडिसिन का एग्जाम था, एंड द क्वेश्चन वाज क्लास टेस्ट. द क्वेश्चन वाज राइट एन एसे ऑन लोबार निमोनिया. फाइन. अपने हिसाब से मैंने सारा कुछ उसमें लिखा था, जो किताब में, जो उस टाइम हम किताब पढ़ते थे गोलवाला की, उसमें जो लिखा था मैंने सारा कुछ अपने उसमें लिख दिया. बट व्हेन आई गॉट द मार्क्स, आई गॉट 5 आउट ऑफ 10. अब वो थोड़ा सा एंटी क्लाइमैक्स था, सो आई वेंट टू द टीचर एंड सेड, सर यू गेव मी 5, प्लीज मेरे को ये बता दो कि अगली बार मैं उसमें क्या लिखूं. तो उन्होंने पन्ने पुन्ने पलटे, कहता चलो 5.5 कर देता हूँ मैं. You know, that is where the problem starts, when you give marks without thinking. If you have to explain your grades, you will think. आपने निमोनिया की डेफिनेशन ठीक लिखी है, उसके क्लिनिकल फीचर्स भी ठीक लिखे हैं, पर आपने ये नहीं बताया कि एडल्ट और चाइल्ड में क्या फर्क होता है. आपने एक्सरे फाइंडिंग ठीक लिखी है, पर ट्रीटमेंट में आपने पुरानी पेंसिलिन लिखी है. यू हैव नॉट रिटन अबाउट the orally useful drugs which would have made it better. Therefore, I am giving you 6. No, आप भी जस्टिफाई हो गए, और स्टूडेंट को भी फीडबैक मिल गई कि इन फ्यूचर इफ ही हैज टू राइट समथिंग, देन व्हाट ही और शी शुड डू. एंड स्पेशली फॉर फॉर्मेटिव असेसमेंट, ग्लोबल रेटिंग्स आर वेरी इंपॉर्टेंट, बिकॉज इनबिल्ट फीडबैक हो जाता है उसमें. और I have done 4 5 6 courses from IGNU. उनके सिस्टम ही ऐसा है, वो ABCD ग्रेड आपको करते हैं, और हर आंसर के बाद में आपने 6 लाइनें छोड़नी होती हैं. वो 6 लाइनों में असेसर ने अपना ग्रेड जस्टिफाई करना होता है. तो उनकी कोई भी कॉपी जो आपको वापस मिलती है बिना ग्रेड जस्टिफिकेशन के नहीं. सो इट टेल्स मी कि नेक्स्ट टाइम मैं क्या करूं और क्या ना. वन ऑफ द रीजंस फॉर दिस प्रॉब्ली इज बिकॉज डिस्टेंस लर्निंग में फेस टू फेस नहीं होता, दूर से करना होता है. सो दैट इज वन वे ऑफ कम्युनिकेटिंग टू द स्टूडेंट. बट आई फाउंड इट कि इवन इन योर फेस टू फेस टीचिंग, You can actually use this practice. You may not write 6 lines, you may not write a big essay on that, but you can surely justify why pass, why fail, why distinction. So that he or she can replicate this in future. Now, if we compare checklist versus global ratings, और ये ऑस्की की क्रिटिसिज्म में बहुत बारी आता है, जो चेकलिस्ट होती हैं वो सिर्फ थॉरोनेस असेस करती हैं कि आपने सारा कुछ कर लिया कि नहीं, पर अच्छा किया कि नहीं किया, ठीक किया कि नहीं किया, वो नहीं असेस करते. एंड देयर आर plenty of studies to show that thoroughness does not mean competence. In fact, when they tried OSCE stations on students and professors, who got more marks? Students. क्योंकि उनको वो उस हिसाब से उन्होंने जाना होता है. प्रोफेसर क्या होता है, वो 2 लाइनें पढ़ के ही कैन मेक ए डायग्नोसिस. ही विल नॉट गो इनटू ऑल दैट. और पीडियाट्रिक में ये बड़ा कॉमन होता है. आई एम श्योर रूजी मस्ट हैव एक्सपीरियंस दिस. वो 16 साल का भी लड़का आ जाता है जब, तो उससे पूछते हैं ब्रेस्ट फीड कितने दिन करे, क्योंकि वो प्रोटोकॉल में लिखा है, वो पूछना है तो वो पूछेंगे. Whereas experts can make a diagnosis with lesser questions, lesser amount of information. Then high objectivity does not mean reliability. ये हम पूरा सेशन पिछली बार कर चुके हैं. So the recommendation generally is that for procedural task, you use checklist. Whereas for attitudinal task, including communication, clinical reasoning, professionalism, ethics, empathy, sympathy, you use rating scales. Now, to improve their reliability, what you need to keep in mind is don't make it too easy, don't make it too difficult. Well, if it is, just like a metal scanner at the airport, it should ring only when you are carrying a suspicious object. अब उसको आप इतना ट्यून कर दो कि आपकी घड़ी को भी बजने लग जाए वो, तो फिर उसकी वैल्यू खत्म हो जाती है. वो जो भी निकलता है वो बजा बजा देता है. या उसको इतना वो कर दो कि जो मंजिल लेते जाते हो बाजा नहीं बजता. So that doesn't help you. So it should ring at the right moment. So it should not be too easy. It should not be too difficult. Don't have too many rating points. Don't have 11-point scale, 13-point scale. Theoretically, yes, people have used 13-point scale, but don't go to that. And actually, the best approach, I would say, for most of the teachers in most of the situations is to use global ratings in place of a checklist. Because you just describe and justify your grades. Why I am giving you 5. That takes care of everything. Leniency effect can be there. Some people, अच्छा चलो, I gave you that example of cotton उठा ली तो नंबर दे दिया. वो पिन प्रिक करना था, पिन उठा ली फिर रख दी, उठाई तो थी ना, नंबर दे दिया. That can happen. There are others who won't give a mark until and unless बिल्कुल पिन खो भी ना दे वो. So that leniency and strictness rating can be an issue. Rater fatigue can be a problem. 2, 3, 4 स्टूडेंट तक ठीक रहता है. 5वें पे फिर ना वही, because it's so repetitive that you actually don't pay enough attention to giving a good rating. और अगर कभी एयरपोर्ट की सिक्योरिटी लाइन में आपने देखा हो तो हर 5 या 6 बैग्स के बाद में वो बंदा चेंज हो जाता है. He moves away, next person comes, he sits there for some time, then he moves away, and then this person comes back. It's because it's so repetitive that you tend to lose attention. Then we earlier discussed construct irrelevance. मतलब मेजर करना कुछ होता है, कर कुछ रहे होते हैं। और इट कुड बी कंस्ट्रक्ट अंडर रिप्रेजेंटेशन, जब आप पूरी चीज कवर नहीं करते हो, सिर्फ यू नो टेंड टू सुपरफिशियली कवर ओनली अ पार्ट ऑफ इट एंड लीव आउट रेस्ट ऑफ द थिंग्स. Now, rated training is important, and especially you need to tell why a scale has been chosen, because it makes all the difference. How you are going to use it, what are you assessing? नहीं तो वो बहुत गलत गलत चीजें हम असेस करने लग जाते हैं. असेस हमने कम्युनिकेशन करना होता है, चले हम लैंग्वेज पे जाते हैं. असेस हमने लैंग्वेज करनी होती है, असेस हम हमारी नो इन आवर फाइनल प्रॉफ एग्जामिनेशन व्हेन आई वाज अ स्टूडेंट, वो ऑफ्थेल्मोलॉजी में वी वर सपोज टू गो विद अ टाई. 5 साल हमने टाई नहीं पहनी होती थी, वो दिन टाई पहन के जानी होती थी. तो आपकी असेसमेंट जो थी वो उस पे हुआ करती थी rather than your practical skills. So one should be very clear about what you are assessing. और यहाँ पे वही complete performance, as I said, it becomes actually difficult to define कि बस ये complete है, इसके आगे कुछ नहीं हो सकता. So be careful about that part. Okay, I'll now quickly move over to rubrics. Rubric is a modification of rating scale, right? Or when you have to do multiple characteristics of the same thing. For example, the criteria, उसने क्या किया, कैसे किया. Descriptive markers, like कि communication बहुत अच्छा था, language बहुत अच्छी थी, पर ये नहीं ठीक था, वो नहीं ठीक था. And when you have to score. So it's a three-dimensional figure. Rubric is three-dimensional, which includes criteria, descriptive markers, and scoring. Take an example. Take a look at this. ये 45 पॉइंट का मार्किंग है, 45. एंड व्हाट इज ऑन दिस साइड? Scoring. So this side is scoring. पीछे जाऊं, criteria, descriptive markers, and scoring. So criteria ये वाले, descriptive markers ये वाले, और scoring ये वाले. और हर चीज पे आपने उसका ब्रेकअप दे दिया कि if he does everything like this, he gets 12 points. If he does only this, 8 points, 4 points, 2 points. So scoring, criteria, and descriptor. So it's a three-dimensional. जो हम commonly use करते हैं वो हम ये दो वाले करते हैं, scoring and criteria. Even Likert scale में भी बाकी हम ये दो use करते हैं. So what you need to do is to add the third dimension. कुछ इसने याद दिलाया, इसने याद दिलाया कुछ, कोई रेटिंग स्केल की टाइप, behaviorally anchored rating scale. So you have described the behavior, and based on that behavior, you are actually marking the student. Okay, so over to you. What questions? What questions?
It's when we make them, we have to predict them.
देखो, I won't use the term validated. Validated has a very different connotation. But what I would say is that there should be consensus. So in your department, you sit together, talk to people, show to them, and just find out everybody's viewpoints, everybody's impressions. Because it's easy to get swayed because of your own preoccupations. मेरे हिसाब से तो ये करना चाहिए था, ये नहीं किया तो फिर
So checklist, when we had read about checklist, somewhere I have read, maybe in your book, okay, checklists were better than global rating and were completely replaced. Maybe in OSCE में पढ़ा था, maybe
उल्टा है.
उल्टा है. So there we should replace now checklists and replace them with global rating.
I won't say go for this or go for that. What I would say कि जब शुरू में देते हो फर्स्ट ईयर में, फॉर एग्जांपल वो यूरिन बेनेडिक्ट वाला जो स्टेशन है, वहां पे यू वुड रादर कीप ए चेकलिस्ट. बट एज यू मूव फर्दर कि ही डज ए यूरिन एग्जामिनेशन एंड काउंसल्स द पेशेंट, फिर यू
Communication skills
फिर
are
यू
checked
गो
up.
फॉर रेटिंग स्किल्स, और सीनियर जाते हो तो देन यू गो फॉर बिहेवियरली एंकर्ड रेटिंग स्किल्स और रूब्रिक्स.
Maybe to describe this.
Any comments from the guests? Ruzi, Sushant?
Sir, the last slide, just third point, I just wanted to, can you please tell it again? Two dimensions I could understand. One is point and what is the third one, sir?
Criterion,
Criteria.
descriptive markers, and scoring.
Okay.
And if you look at the example, then here is the scoring.
Scoring, okay.
And you have also built in scoring here.
Hmm.
These are the descriptors.
Hmm.
And these are the criteria.
Okay.
Again, if you see here, you know, in-depth engagement, moderate engagement, actually a lot depends on your interpretation. So one examiner may feel इसको बहुत कुछ आता है student को, another one might say कि बहुत superficial knowledge है. So these can be issues even in using rubrics.
It is more subjective than the using the rating scales or the checklists.
But I would say they are more objective in the sense that they make you think about what you are doing. अगर आप खाली रेटिंग स्केल में उसको 2 करके छोड़ दोगे, so you don't know why you did 2. Student will also know why I got. But if you have this point, for example, and you give him 8 points, then at least he has something to think on, something to reflect, and something to build on, that this is what he needs to improve further.
Formative assessment के लिए they are better.
Most of these are actually for formative assessment. You won't use these for summative.
Checklist तो करते हैं.
Maybe. But there also, see, one of the side effects of checklist is you can actually use it to teach.
Yes.
अब ये वाला यूरिन वाला अगर आप
Yes.
चेकलिस्ट बना के स्टूडेंट को दे दो तो आपने पढ़ा भी तो दिया ना उसको. बट एट द सेम टाइम द डिसएडवांटेज इज कि फिर वो लर्निंग और असेसमेंट में फर्क नहीं रह जाता. You know, the students would remember the checklist rather than learning the procedure. That can be a big issue. और वैसे भी I think I told you last time also, it's very difficult to really maintain the secrecy of checklist. अब जितना मर्जी करो, हम 93 से लगा रहे थे ऑस्की सीएमसी में, और इनवेरिएबली 2 या 3 के बाद में चेकलिस्ट आउट हो जाती है. तो यू कैन मेक आउट. वो स्टूडेंट डेवलपमेंटल स्टेशन होता है कि कब उठा, कब खड़ा हुआ, कब चला. तो शुरू में तो दे स्ट्रगल, अच्छा फिर क्या हुआ, बट देन सडनली आफ्टर 3 or 4 cycles you realize everybody come, baby इतना कम हुआ, बड़ा कम सोया कम. Then you know he has memorized the checklist. He is not really having an understanding of the problem. So और ये यही नहीं है, a global problem. It's a global problem. कहीं पे भी maintaining the secrecy of checklist is a big issue. तो इसलिए चेकलिस्ट भी don't simply make it for examine the urine. वहां पे प्रॉब्लम आ जाएगी. But if you make a checklist for communicate with the patient, then you can still keep on using those multiple times.
Checklist should be secretive. Shouldn't they be disclosed before
नहीं, पर फिर प्रॉब्लम यही है ना कि अगर आप डिस्क्लोज कर दोगे तो दे विल रिमेंबर द चेकलिस्ट rather than learning the procedure. और ये well researched aspect है, you know, it's well researched that students would rather remember the checklist than learn the procedure.
नहीं देनी चाहिए, ना दे।
फिर तो ऐसे ही हुआ ना, आपने एमसीक्यू की उनको की दे दी. You know, giving a checklist in advance is just like handing over a key of the MCQ test. You don't want to do that.
चेकलिस्ट देखिए, हम जैसे सारे इंजेक्शंस हैं आईवी फार्मा में, तो वी यूज्ड टू गिव, वी आर गिविंग प्रोसीजर याद सर, हम अगर
फिर आप टेस्ट क्या कर रहे हो? उनकी मेमोरी टेस्ट कर रहे हो.
वेटेज ना दे सर, किसी को हमने वेटेज ज्यादा दी, मार्क्स किसको 2 नंबर दे दिए, उसने आईवी में बैक फ्लो देखा कि नहीं देखा, उसका नहीं बताएगा कि उसके 2 नंबर थे 10 में से।
फिर आपने वो तो लिखा है ना कि बैकफ्लो देखेगा, तो बस फिर वो वही याद करेगा ना.
मतलब यही तो हम चाहते हैं कि देखना है हमको।
अब you can use it as an advantage or you can use it as a disadvantage. I mean, depending.
It's like what we are giving away time. As the first time they were giving competency certification and all, we went with the students and did trials, but they were not able to actually do the competency according to the checklist we will examine on the screen. So we had to really help them out कि यार ये steps याद कर लो, ये steps है.
एग्जामिनर आपको कहता है जी आपने स्टेप्स लिखा दी, चेकलिस्ट क्यों नहीं? मैं कह जी एक ही बात है,
आप उनको स्टेप्स बताओ, वो याद करा लो, बट डोंट गिव चेकलिस्ट, बिकॉज वो वैलिडिटी की इशू आ जाती है ना. फिर ये तो फिर वही बात होगी ना कि आपने एमसीक्यू क्यों नहीं, एमसीक्यू भी बता दो, की भी बता दो, फिर रह क्या गया फिर बाकी, या इवन ऐसे क्वेश्चन भी बता दो, उसका जवाब भी बता दो. दैट्स नो आर्ग्यूमेंट.
ये चेकलिस्ट में मार्क्स पूरा ना बता के बोलते हैं कि इसके तरफ से ये सबसे इम्पोर्टेंट पॉइंट. Actually, other way around, so we can use the checklist to teach them the procedures, and then we can
वो देखो, जो चेकलिस्ट आप एज सच यूज करते हो, लाइक 8 ड्रॉप यूरिन डाली और उसको गर्म कर लिया और कलर मिला लिया, वहां पे चेकलिस्ट देना डेंजरस है. जहां पे आपने ऐसे करना होता है, अच्छा चलो इसकी मेरे को सरफेस मार्किंग करके दिखाओ, वहां ठीक है.
ये ब्लड प्रेशर और बीपी लेना है तो उनको ये स्टेप्स फॉलो करने हैं आपने जब बीपी किया, तो दैट वे वी आर जस्ट टेलिंग देम द स्टेप्स, मे बी दे देन वी गिव देम द चेकलिस्ट.
तो आप स्टेप्स वैसे ही पढ़ाओ ना उसको, बट डोंट हैंड ओवर द चेक. देखो ना, एक्चुअली स्पीकिंग आपके एमसीक्यू में और टीचिंग में क्या फर्क होता है? उसमें भी तो वही पढ़ाते हो ना. Only thing is कि you are using it as assessment. Now, if you hand over the checklist to them, then you will distort their learning. वो अभी आप कह रहे हो कि उसका ब्लड प्रेशर should be raised between systolic and diastolic. फिर वो यही याद कर लेगा कि बीपी चढ़ाना है ऊपर, क्यों चढ़ाना है वो नहीं उसको पता लगेगा. So you don't want them to leave learning and just do memorization of the checklist. Okay, thank you very much.
Hello, sir.
हाँ बोलो बोलो.
Sir, I'm audible?
हाँ, you are audible.
Sir, does it seem that if we create rubrics and give them descriptors, also in some way we are also decreasing the creativity or individuality of the outliers, the outperformers? Shouldn't there be some open-ended assessment also in addition to the rubric? Something is done much better even than your exceptional, something to add on? Maybe not for scoring, but for documentation.
See, Rosie, we traditionally talk of validity and reliability, isn't it? When we are assessing.
Right, sir. Right, sir.
Now, actually, there is a change in thinking, and what people say is that reliability or simple reproducibility of the marks is not important. So they have gone on to fairness in assessment.
Right.
And now fairness is actually considered a more important criteria of assessment than reliability. And in simple words, fairness means same marks for same performance.
Right.
Now there is a difference. For reliability, you were saying consistency of performance. In fairness,
Yes.
you are saying same marks for same performance. So when you say same performance, then you have to have a anchor to tell the examiner as to what is the level of performance of the student. Now, if you look at, I'll show you that slide again. Take for example this one.
Yes, sir.
Now, you think we would curtail the creativity here?
But sir, something individual, something if he does extra with beyond, like in the BME rating, we give beyond expectations. Like this is what we can expect maximum, but sometimes they can, with their open mind, do something which is even beyond what we expect them to perform.
But look at this scale, for
Yes,
example,
sir. This is
and
open quite
what extra you can think a student would do, which doesn't fit into this.
accepted feedback and also. This is almost covering everything, sir.
Yeah, that's what I'm saying. So if your rubric is good,
If it is comprehensive, then probably.
and actually if you read the statements don't really relate to the actual behavior. They are the categories of behavior. Providing and receiving feedback, you are leaving open-ended. So a student who provides feedback in a better way is still acceptable there, contrasted to somebody who is doing it not so well.
Right.
So if you look here, and actually that depends a lot on the quality of scales and rubrics that you design. If your rubric provides broad guidelines, then it becomes easy for the examiner to really decide which way the student should go. But you are not, because I cannot think anything which we are actually suppressing here.
Right.
Or look at another example. So you have actually given a range. So
Right.
different students would fit into different ranges. Somebody would be doing it almost never, and somebody would be doing it almost always requiring help and guidance. So again, you are not suppressing a student's creativity. Now that has to be built within the items.
Right.
Okay. Yeah. Yeah. Sushant, you wanted to say something? Okay. So,
So one more question.
sure, sure.
Is global rating scale, can we say, synonymous with the expert subjective judgment
Yes,
in a way?
almost. Only difference is that actually both are almost similar, and both require uh, explaining the grades or marks that you have given to the student.
Clarity in assessment.
Right now it might take some time for me to fish that out, but I'll show you the assignments that we submitted to Maastricht and the expert subjective rating that was given by the assessors there. Even till today, I find it extremely useful to work with them because they give me a direction as to what I did well and what else I could have done.
Right.
So maybe next time, whenever we are on Zoom, I'll project that for you to read.
Right. Thank you. Thank you.
Okay, thank you so much.
I think
Thank
paper is for the faculty research.
देखो, all assessments take time. Let's accept that. You know, is not कि किसी किताब से 10 MCQ निकाले और दे दिए. That doesn't help. They require time, effort, and quality of assessment tools is proportional to the effort that you put in designing that particular assessment. So that one has to keep in mind. Okay, thank you very much.